All right, I think we are good and the volume's coming in. So, guys, good morning. It's Dr. Pearlman coming to you from Paramount Chiropractic and Wellness. And if you can hear the back of the sinuses, I'm just getting over, I guess you could say, like my version of a cold or whatever it is that I had, where really for like a week I felt fine. And then, like in the last 3 days, I got real achy. And like that deep, deep ache could only mean one thing, in my opinion, in my experience, which is that fatigue, because the body is fatigued, right? You're immunocompromised, your body becomes fatigued, that fatigue leads to susceptibility, and then you could end up getting an injury. Now, I don't believe I got an injury, but I certainly feel like my muscles are at the point that they are vulnerable, could be injured, certainly very sore. And I was like, oh man, I'm getting sick here. And so then yesterday, I pretty much rested all Wednesday, went and got adjusted as well, and then basically napped and hung out. Took vitamin D and ate oranges and ate blueberries and was eating all types of things with good micronutrients, and hoping they were antioxidant rich, and hoping that I could feel better. What's interesting is, so now that I have this like in the back of the throat, feel like the nasopharynx deep back here, kind of like upper respiratory, but nothing going on in my head. I feel that I'm, better despite my voice maybe sounding worse, because I feel like it's working its way out, because that's, this is like the first time in a week that I'm not really lightheaded, kind of a little dizzy. And that dizziness could clearly be associated with viral type infection, because one of the number one leading causes associated with vertigo, or a type of vertigo, is actually following or in the midst of a virus infection. If you don't believe me, go ahead and look it up. Uh, Getting lightheaded, having headaches, getting stomach pains, all those are related to things that are called cranial nerves, which are in the brainstem. Those cranial nerves are the same reason that during COVID, you heard a lot about people saying, I can't smell and I can't taste. Those are cranial nerve related visceral issues for the same reason that you get dizzy, vestibular cochlear, your vestibular system connected to trigeminal nerves, to the cranial nerve 5, 7, 9, 10. You have your vagus nerve, the wanderer, that goes up from here and down to the stomach. It's the reason we have what we call a gut brain axis, axis, AXIS. And so these things are, important to know, super level physiology, so you don't freak out and say, oh no, like what's wrong with me? Why is this happening? Well, have you been sick? Well, yeah, last week I was sick. I stayed home for a couple of days, and now you see some of the reason. So what I want to do is show you at least what I do to help me get over this type of sickness this time of year, because, let's face it, when it goes from 70 degrees to 20 degrees ish, you get sick, because that thermal regulation in your body, especially if you're not like dressed appropriate for it, it hits you once, like a ton of bricks. It's very hard, especially for people that aren't very, adaptable. And in our rat race, stress sort of dominated society that we all live in, we can kind of all agree that we may not really be best equipped, so to speak, to adapt to stressors, and that leave us vulnerable. So one of the things that I like to do just straight out of the gates is I'm a vitamin D-aholic. I really like to make sure that I get enough vitamin D, because if you're not getting enough vitamin D, you really aren't doing your immune system any favors. I don't need to be the guy on this video to explain why. We're just going to say that vitamin D is something that is, essential for human beings. You don't want it to not be something that you not only don't get enough exposure, whether it be sunlight or through supplementation, but also you don't want to not be able to synthesize it. You want to make sure you actually get your blood work once in a while to actually make sure that your vitamin D levels are in good health, let alone your baseline metabolic panel. So things like vitamin D from like an Ultimate Omega that has enough fish oil for being anti-inflammatory in nature, but also has vitamin D. You can take Carlson's or just about any brand, Source Naturals, whatever, vitamin D. Okay. The second thing is what happens when I start to get sick. This is sort of, I guess you could say, advice that I don't see a lot of people talking about. So if you made it to this point in the video, this is what we do. You go and get yourself a nasal spray. Now you can get this with aloe, right, to help soothe, or you can just get whatever this like nasal wash, nasal spray is called, like saline. There you go. instantly relieves a dry nasal passage. So when we're talking about microbes and dry air and dust and things of that getting all up in here, aggravating the throat, whether it be for allergies, but especially when you're starting to feel sick, you should be nasal washing like crazy every opportunity you get, then blowing your nose, nasal washing, blowing your nose. A lot of people talk about doing the neti pot. That's a more extreme example of it. Yes, you can do it if you've ever done the neti pot. You can pour that right up your, you can pour that in your ear and feel it out your nose. You can pour it up your nose and feel it out your ear. You can go ahead and clean all that out with good old salt water, which brings me to my step number 2, which is after you're done washing your ears, rinsing your ears with a nasal spray, you go ahead and you get yourself a cup of nice warm water. Of course, you boil it first, then you get the warm water. You pour a lot of good pink Himalayan sea salt, get it all up in there with lemon. You don't even have to add honey. And then you do a gargle. Now this time I didn't gargle, but you gargle like crazy with this. Go ahead and get a lot of that bacteria, start to get that antibiotic type of effect just from the lemon cleansing along with the soothing salt water. And if you want to one up, and this is what I highly recommend, especially when you've been in contact with someone who's symptomatic, this is something that I do a lot at my office. My patients even know it. If I think like you've been coughing in my office or anything like that, I go and I get my antiseptic mouthwash. It's up there. I don't know what it's called. It's like a CVS brand of mouthwash. It's antiseptic. And I'm going to go ahead and gargle, get it deep back of the throat, gargle. And, I'm going to make sure that I do everything I can to kill those microbes, the viral particles, whatever it is. The reason I even say this is there is clinical data. There is research that shows that you can cut down on these foreign pathogens, these viral pathogens, or bacterial pathogens. I don't know actually where the research is like viral versus bacterial. I believe it's viral. Just by nasal washing and by gargling with antiseptic, you can cut down on pathogens by whatever the percentage is. I have been very fortunate, year after year, except for actual like peak COVID, where I did get very sick, and that was when I experienced my worst vertigo of my whole life, which has since been remedied with specific chiropractic and really nothing else. I can be honest, if it doesn't come back, I'm getting the right adjustment at the right time by a trained chiropractor who takes the time to palpate the neck and understand what it is, why they're doing, and actually being able to test things like balance and the health of your cerebellum, the saccade, any which way you want to say it, of the eyes, to be able to determine which side of the brain may be off balance based on inflammation of the brainstem, which, by the way, we don't have any per se evidence to suggest that that is exactly what's going on. I just see it clinically on top of my personal experience as a patient work for me, and I see it work time and time again. So the lightheadedness / dizzy type symptoms, chiropractic for sure. I wouldn't let anyone tell you otherwise. Why? Because frankly, I'm just here telling you this is how it works for me, and I see it for my patients. And now nasal spraying and gargling with antiseptic and or, of course, salt water and lemon, maybe even some honey. And I just got a nice tip from a friend of mine, Chloe, that if you boil real thyme, 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 in a pot, and then you let it seep, then you're going to drink that hot like a tea with lemon and honey. Really good for treating and soothing the throat. I did it the other night. Guess what? It worked, because about a day later, it's really not as bad. Actually, it's significantly better, if I'm being completely honest, because the more you rest, the more you will recover. And one of the last 2 things I'll show you, and again, I'm not a medical doctor making recommendations, just a little old doctor of chiropractic, which, by the way, if you guys didn't know that, a doctor of chiropractic, like some of these people like to say, not even a real doctor. No, we are real doctors of chiropractic. And for the less educated chiropractors who still haven't figured things out, we don't have a doctrine or a doctorate, okay? That's not a thing. Being indoctrinated into something, that's something. Having a doctorate is having a PhD, and being a doctor of is being like a dentist or being a chiropractor. I'm sure there's another doctor of somewhere. And then an MD or a DO, you guys get your typical, that's Dr. Whitecoat. But just so you all out there know, I'm not a licensed medical physician giving advice. I'm telling you it works for me. And what I like for inflammation, as you can see, right, it says NSAID, that's non-steroidal anti-inflammatory. This is aspirin, low-dose aspirin. I like a low-dose aspirin when things are getting real achy and I'm not feeling good, and I feel like I could, use some TLC in the department of, man, why am I in a good amount of pain? Why is there so much congestion? Why are things so inflamed? I like 2 low-dose baby aspirin for myself. I'm not saying you should, but man, does it beat taking Advil or Tylenol or acetaminophen or some of these things at 500 milligrams, 250 milligrams. If your total dose could be 162 milligrams, it's much safer once in a while to get that anti-inflammatory effect where you don't have to be so staunch and say, I don't take pills. Okay, whatever, don't take pills. You certainly don't want to take, you certainly don't want to take opioids. You certainly don't want to take, not metformin, oh my God. You certainly don't want to take, what do they give you for nerve pain? I almost said serotonin, but it's not serotonin. Oh God, I hate when I draw blanks like that. You don't want to take the one for the L-Dopa type drug. Oh my God, this is crazy. Well, you don't want to take that nerve inhibiting, pain drug that does nothing. You don't want to take muscle relaxers. You don't want to take these big, bulky, hardcore drugs, these hardcore NSAIDs that, are going to, hurt you. Gabapentin is what I was going after. Gabapentin. You don't want to take these drugs to fuck with your cognitive ability. You don't want to take these drugs that's going to make you absolutely destroy your insides. If you took enough of these hair baby aspirin, if you take enough of these, your insides over time are going to struggle. They're going to be hurt. They're just going to do it. They inhibit mucus production. That's how it works. Whether they do it in a way with a COX-1 and COX-2 and the deep physiology that I'm a little rusty on, inhibiting mucus, or we should say the mucous membrane production, thus like it dries it out, like it basically drying out your inside. And then the bottom of that, GI eventually won't be able to do what it's, meant to do based on like good working physiology. Thus you get what we call GI bleeding and ulcers, and you end up in the hospital and you're bleeding out your guts. It happens to many hundreds times over Americans each year. And it's a real shame because they are reliant on pills to deal with pain. So I am saying, I'm not advising this. I'm simply saying this is what I do. Use with caution. It's very low dose. That's it. On top of the fact that its number 1 protocol is an anticoagulant. So if you're concerned about coagulating, it's an anticoagulant. It's, platelets like to get all clogged up and sticky when things are going bad in the cardiac world. This is a prophylactic way to prevent that. Just telling you the truth. And one of the last things I like here, I think this is, what's this called? Is it called Uku? What is it? Unka from the Unka kind of like cough relief syrup from Whole Foods. Now, you can get this at natural grocers, Whole Foods, Sprouts, especially here in Texas. And what I've noticed is, this has really done well for me when it comes to, again, that last residual kind of sore throat and cough feeling. And this is what we call its ingredients are pelargonium. Yeah, pelargonium. So basically, this is an herb. It's a plant medicine that's been used, kind of like Eastern, medicine for generations as far as I'm concerned, based on this little research that I did. And it's, got some antibacterial, antiviral particles. It's, supposed to shorten duration of cold-like symptoms. And I personally have felt like that has been soothing for the throat and has helped me over time with my symptoms. So right there, I just gave it to you guys. I gave you the Dr. Pearlman personal protocol, not advising you to do it. I'm simply saying my personal protocol and my experience, what has worked for me. You start to get sick, you better get adjusted, you better get some rest. Gargle with salt water, lemon, put some honey, boil some thyme, put the honey and lemon in afterwards, drink it as a tea, drink it slow, get plenty of vitamin C from things like oranges, strawberries, grapefruits, blueberries, things of that nature. Antioxidants in there, right? You got to accept that your immune system is compromised. You want to get as much rest and as much micronutrients in you as possible. Coming off that, or if you're in too much pain, I think baby aspirin is a great way to kind of just, Western medicine sort of reduce some inflammation, anticoagulate, get that blood flow possibly to be a little bit cleaner, and just get some rest. Always using the nasal wash and gargling with antiseptic and just getting some sleep, guys. And if you can do that, along with drinking your tea and kind of, getting enough rest, I might have said that enough times now, you should be able to combat that common cold or some of those virus symptoms, especially if you're lightheaded or start to get real dizzy, you get into that chiropractor, get your your nervous system checked, and make sure that you're safe for adjusting. And I think that you will see how this benefits you in the long run as well. So guys, have a wonderful day. If you ever need anything, feel free to comment. It's Dr. Pearlman.